MRI and GPS are two independent data points. Together, they really tell a much greater story. MRI is an image data point that we can obtain that really looks at the prostate and tells us what are the chances of having a higher grade or larger volume cancer present. The GPS really gets at the biology of what's going on within the tumor. So they're very complementary for each other. Now it turns out, because we use MRI to perform fusion biopsies, and often the sample that we're finding the lesions will often be the sample that is used to obtain the GPS. And so we can really determine the biology of the largest tumor and potentially most aggressive tumor in there. So we really find that they're complementary for each other, and they can really help us make that decision whether that largest lesion, which is usually the dominant one, is most likely to stay in its more indolent form, and active surveillance would be safe, versus that it would be more aggressive over time that we'd have to treat. The patients, especially with Gleason 3+4 low volume, who are considering active surveillance, have a lot of more anxiety than a typical patient with Gleason 3+3 low volume. And when you show them that their biology of the tumor is on the lower risk side, or that it's acceptable that they have a low risk of progressing over time to a 4+3, they feel more confident. And certainly I feel more confident that even though in the microscope it looks like an intermediate risk tumor, the biology suggests, which is captured by the GPS, that it's actually a lower risk tumor.
I think the multiparametric MRI and the GPS score are complementary at times and mutually exclusive at other times. There are people who come back with high volume, low risk disease or perineural invasion, which makes me concerned that I need more information than the MRI alone can give me. So I use a GPS to help understand the risk for those patients. So the GPS score comes in as a complement to give me an idea about his risk, because by Gleason score, he's low risk, but by GPS score, he may be higher risk.
MRI itself has limitations. Many people think it's become the gold standard for doing biopsies and finding whether there's cancer there. But a negative biopsy, meaning that the prostate looks entirely normal, does not mean that that individual doesn't have cancer, and it does not mean particularly that they have an aggressive form. So it is certainly reassuring if it's negative. However, if it is negative, you still need to biopsy that patient, obtain a GPS to get the true biology, because that's an additional signal that we have to help interpret. So I think in that specific scenario, GPS is really more useful because it provides additional information that the MRI doesn't have.